there's no protrusions or wounds, lesions, anything like that. We're going to auscultate your abdomen. We're going to start by the right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. We're listening for active vowel sounds where we don't want hyperactive or hypoactive. We're going to palpate your abdomen. We're ensuring that there's no pain or tenderness. So if you feel anything, just let me know. We're going to do the right upper, left upper, left lower, and right lower. Ensuring there's no tenderness, and also feeling your skin, making sure that it's cool. There's no signs of a temperature. There's no excessive dryness or excessive moisture. Sit back up. I'm going to go to your, do you do a monthly breast exam? No? Okay, so you want to pick the same day every month to do the monthly breast exam. The benefits of doing that is so if something abnormal comes up, you start having a bump or tenderness or drainage, you can report that to your doctor. So how you would do that is either in the shower or laying down. You can put your arm behind your head, and you would start from your armpit, and in a circular clockwise motion, you'll go down towards your nipple and feel for any types of bumps that are on a normal basis, and you're going to know your body better than anybody else. You're going to go down towards your nipple, and when you get to your nipple, you're going to pinch, and if there's any drainage, you would report that to your doctor. And you would do that on both sides. Now we're going to go to your posterior side of your thorax, which is your back. We're checking your spine, making sure that it is centrally aligned. There's no curvature or hunches or anything like that. We're going to, I'm listening for any sounds of bronchi or wheezing. We're going to palpate your respiratory in the back. I'm going to have you say 99 for me. Again? Again? Okay. I'm checking symmetry on both sides, making sure that I feel the reverberation on both sides, and that there's no signs of diminished or fluid in the lung. I'm also going to have you take a breath. We're checking to make sure that your lungs are expanding and deflating equally, and that there's no signs of a collapsed lung. We're going to auscultate your lung sounds. We're going to side to side. Once again, I'm listening for any type of wheezing or bronchi. And then we listen posteriorly and laterally on both sides, as we want to make sure that it's equal. I'm going to have you lay back down. We're going to check your upper extremities. I'm inspecting for any signs of lesions or bumps. We're going to palpate your skin, checking your tartar, making sure that there is a good rebound and no signs of dehydration. We're going to palpate your capillary refills, making sure that they refill within a few seconds of each other. Also checking your fingernails for any signs of clubbing. I'm going to have you squeeze my hands. I'm going to test your strength. Okay. And I want you to pull my hands towards you and push. And then have you extend your arms out. Flex them back in. We're also going to have you roll your arms and your wrists. I should have had you lay down for that. Sorry. We're going to check your neurological sensations. So I'm going to have you close your eyes. I want you to tell me when you feel something sharp, something dull, sharp, sharp, dull. Okay, we're going to check that on both sides, making sure that there's some sensation. Next, we're going to check your reflexes, your brachioradialis, making sure that when we wrap your hands, whenever we push on the tendon that your hand is constricting, we're going to check your biceps, making sure that they're reflexing, and then your tricep. I would have you sit up and relax your arm completely, making sure that there would be like a small switch. And we would do that on both sides, making sure that it's symmetrical. I'm going to check your radial pulse and your brachial pulse, ensuring that they're within a few seconds of each other, and we can also check that with your apical pulse. Now I'm going to move on to your lower extremities. I'm going to make sure that they're, we're inspecting, making sure there's no excessive dryness or swelling, visible signs of swelling, lesions, bumps, abnormalities. We're going to palpate, checking for any signs of edema. Fitting edema, while we're checking your upper extremities, we would do the same. We're going to palpate your pulses, so your femoral pulse on both sides, which is up in your groin. We're going to check your popliteal pulse, which is behind your knee. Your tibial pulse, which is behind your ankle, and then your pedal pulse, which is on the top of your foot and your big toe. We're going to check your reflexes. Generally, I'd have you hang your legs off to the side and check your popliteal, making sure that your leg would kick out. And we would do that on both sides, expecting them to do the exact same thing with the same force. Do your popliteal pulse with the back side of the hammer to, not popliteal pulse. Your Achilles, making sure that your foot kicks out, and we would do that on both sides. And then we would check your plantar, making sure that your foot flares out on both sides of your toes flare out. We're going to check your neurological sensations by having you close your eyes. And like we did at the top, I'm going to have you tell me whenever you feel something sharp and something dull. Sharp. Dull. Sharp. Dull. Sharp. Okay. And then I would generally have your socks off, and we would check your we'd have your socks off to check the pedal pulse as well, but check your capillary refills, making sure that they rebound quickly within a few seconds, making sure there's no signs of infection or clubbing or any type of abnormalities that would show sign of something else going on. And we're going to check your range of motion. We'll have you lift up your legs and then down. And then on the other side, we'd have you do the same. And test your strength by having you push your feet up against spine. Pulling back. Lifting your one leg up. And then pulling back against spine. Okay? And we would have you walk to check your gait, making sure that there's no signs of limping, and that would also check some of your anterior thorax, making sure that you're able to walk evenly. And then while we did that, we would, which we did earlier, your cranial nerve number 2, we would test on the sound chart, making sure your visual acuity, which was at 20/20, is at 20/20, so that concludes our physical assessment. Thank you.